Hi, my name's Alan Prost, and I'm an instructor of respiratory therapy at the Southern Alberta Institute of Technology. And what I'm going to do for you today is give you a short tutorial on how to do blood gas classification.
Okay, so what we're going to do is something a little bit different. We're talking about arterial blood gas classification, but I'm going to do it graphically. And that's what's different about the way we're going to do classification this time in this video than maybe you've seen some other ways. So let's get started. Some little bit of background about why we do this, because we're looking at to establish the association between the respiratory and the metabolic systems of the body. We know that they want to control pH in the body, and those are what we're going to look at with our arterial blood gas and try to define what's happening with that. So looking at and classifying these allows us to identify the major elements that are controlling pH within the body. And of course, that's the respiratory system, which is your breathing, which controls your CO2, and your metabolic system, which is mostly your kidneys that are going to retain or excrete hydrogen ions or bicarbonate. So let's take a look at this. All right, so the key basics here, we need to know what a normal blood gas is. So this is if you're in a steady state for a healthy person. We're not going to look at oxygenation in this video. That's a separate discussion. We're looking at the association between CO2, pH, and then the calculated values from an arterial blood gas are the bicarbonate and the base excess. So it's important to realize that these are calculated values, and we look at these two here to give us clues about what's happening with this association with pH and CO2. So those are what we're going to define for you today by examples. Okay, some more of the basics. Of course, when the CO2 increases because you've decreased your respiratory rate or you're not breathing enough, that's going to cause a decrease in pH, so it's going to make you acidotic. If your CO2 decreases because you're over-breathing, that's going to cause a change in an increase in pH, making you alkalotic. So that's a couple of basic relationships with this respiratory system. Respiratory conditions change PaCO2, and there's a direct relationship to the amount they're going to change the pH. Metabolic conditions, on the other hand, are going to be just about the pH change. All right? They don't change the CO2. That's a respiratory condition. So this is your kidneys, for example. That's one of the major factors that are going to control the amount of hydrogen ions and bicarbonate in your system. This is usually a slow factor, and this is usually a faster factor. Respiration can change instantly, where metabolic conditions usually take a little bit of time. So we're going to use some conventions here when we're talking about this. All right, whenever we're talking about ventilation, so the control of CO2, I'm going to try to use this blue color. I might get that mixed up once in a while. All right, so we know a normal blood gas is between 35 and 40. So what we're going to use in our discussions today is a reference blood gas where everything's in the normal range. pH is 7.4, CO2 is 40, and then when we get talking about the metabolic system, we're going to talk about the pH, of course, the bicarbonate, and the base excess. Now you notice in a normal blood gas, the base excess is going to be plus or minus 2. That's a normal range, okay? So it could be anywhere from -2 all the way up to +2, and we're going to consider that to be effectively 0 or no change in the base excess. All right, so get orientated to our graphic representation here. This line along the bottom here, this represents pH. All right, body is always striving to maintain in this normal range between about 735 to 745 for a normal pH. That's what our normal blood gases are trying to tell us here about our pH. All right, so if you're onto the right side over here, that's going to be an alkalosis. On the left side, we're going to plot anything that's going to make us acidotic. Okay, so traditionally with blood gas interpretation, what we've done is we used algorithm methods like this, where you find out the pH from an actual blood gas and you just follow it down here, you go to the correct CO2, and then you follow it down and it gives you this uncompensated respiratory acidosis, or one of these conditions down here. My problem with this is that it doesn't help us understand the relationship between pH, CO2, bicarbonate, and base excess. It does it in kind of an abstract way, to me at least. So my goal is to give you this graphic representation of how that works. All right? So we're going to just look at that algorithm in a little bit different way. We're going to use blue when we talk about the CO2. So normally the CO2 is right in this normal range. It's about 40 millimeters of mercury, and it's not going to alter our pH at all. All right. If the CO2 gets higher, all right, so if it increases, it's going to drive us to the acidotic side. All right. If we have low CO2, it's going to drive us to the alkalosis side. All right, so that's our basic representation, and that's how we're going to graphically represent this. You don't have to do any math. No math involved. All right? All right, let's take a look at here. With the base excess, we're going to always say that a positive base excess, so that's greater than 2, is going to drive us to be alkalotic. All right? Now, this is the body's compensation. This shows us this base excess is calculated between the difference between the pH change from the CO2 and the pH change from the metabolic components inside the body. So this shows us the relative comparison of these, and it says when we have a large positive base excess, it tells us that I've got more things alkalotic. So I've got an increase in bicarbonate, for example. Where when it's a negative base excess, I have an increase in hydrogen ions, making me more acidotic. All right, so that's a greater change than just due to the respiratory component alone. That's what the base excess tells us in very simplistic terms. So here's my normal range. All right, well, let's get some examples going here. Okay, so let's start by looking at an example here. So I'm always going to show you our reference blood gas here. All right, that gives you a comparison so you can see what's happening. The condition we're going to be talking about is strictly a respiratory condition. So we're talking about a respiratory acidosis. Now, in this condition, what's happening is I've got an increase in CO2. That's all that's happening is for some reason my patient's not breathing enough and I've got an increase in CO2. There's no effect on the body, there's no compensation. The kidneys haven't had a chance to kick in. This is a really quick thing that happens. So, of course, when I've got an increased CO2, my pH also goes down. So, let's start and showing you how this graphic analysis works. I always start here at my normals. Now, because I've got an increased CO2, all right, I'm going to draw my vector towards the acidotic side because I've got an increased CO2. All right? Doesn't matter how far. Draw them long. Now, when we get talking about, and I'm going to use a different color here, when we get talking about the metabolic component, I'm going to draw that in red. So hopefully you can see that difference here. Now, in this condition, there is no metabolic component. The base excess tells me what the difference is between the pH expected by the change in ventilation as compared to if there was any extra hydrogen ions or something happening by the body. In this condition, because it's strictly a respiratory acidosis, there's no effect on the body other than the pH change due to the increase in CO2. And of course, CO2 is an acid, so it's going to make me acidotic. So there's no metabolic effects. We're just considering this to be a respiratory acidosis. And this is what would happen if a patient just stopped breathing acutely. All right, let's look at another example here. Here is a respiratory alkalosis. All right, so we're going to do this graphically again. Every time I'm going to be doing the same kinds of graphic representation here. So here's our reference blood gas. And what's happened here is I've actually decreased my CO2 now. That's the primary effect. I'm hyperventilating. So let's draw this out graphically here. I've got a decrease in CO2, which is going to drive me towards the alkalosis side of my pH scale. Now, I know there's no effect on from the kidneys or from any metabolic systems because my base excess is within that -2 to +2 range. So it's effectively 0. So when I plot that on here, I can say with a high degree of confidence that there is no change. Oh, my pen color didn't change on me there. So that there's no change. The effect is 0. So this change in pH that we're seeing here is entirely due to the respiratory system. So it's a respiratory alkalosis. All right. So the pH does go up. You can put your little arrow there, but the primary effect here is being caused by the CO2, and we know that because the base excess is 0. So now let's talk about metabolic conditions. And metabolic conditions, all the change in the pH is from something outside of the respiratory system. So it's going to be either we've got an increase or decrease in acids because of something going on in the body. It could be from the kidneys, or it could be from even hypoxia, where we're getting a change in pH. So we're going to talk about a metabolic acidosis, and this is a common situation that can occur with our patients. So from our reference blood gas, you notice that the primary factor is we've got a decreased pH due to some increase in acids, and we've got no change in our respiration, so our CO2 is basically normal. So the way we're going to do this is we're going to plot this out just like we do with all of ours, but because our CO2 is normal, there's no change in our respiratory component. So this is our respiratory component is effectively 0. So what we're going to do is we're going to plot up our metabolic component. So I'm going to draw a little line here, and it's of course is going to make us acidotic because our pH is very low. So we got a pH of 7.20. So this is our metabolic component right here, and what this shows us graphically is that all the change is due to the metabolic components of the blood gas. So this is a metabolic acidosis. Okay, and you'll notice a key thing I want you to see here is that we have a negative base excess. So with a negative base excess, I'm going to draw my line to the left because the negative means I've got a huge change in my pH due to some metabolic condition. Now, it doesn't tell us exactly what, but that negative base excess, and of course our low bicarbonate is giving us that same information that we've got a low bicarbonate because we've got all this free hydrogen ions in there. Okay, so remember that, by the way, these are calculated from our blood gas. They're not actual values, they're calculated. Okay, so let's look at another example. Here we're talking about our metabolic alkalosis. So once again, I've got a change in my pH with no change in CO2. This is strictly a metabolic condition. So once again, I always start drawing when we're doing a vector analysis. I'm going to start off with our respiratory component, but it's effectively 0. Our respiratory component has no vector because we've had no change in CO2. Even if there's just a small change in CO2, that as long as it's within that kind of normal range of 35 to 45, I'd consider that to be no change in CO2. So let's plot now our metabolic vector. So we'll start here, and of course with a high pH, it's going to make us alkalotic. So I'm going to draw this over here, and that brings us to a pH of 7.60. Now you'll notice that I've got a positive base excess. A positive base excess. That tells us that we've got an increase in bicarbonate, and that this change is much greater than just due to the respiratory component alone. All right, so a positive base excess, that's going to draw our metabolic line over to the alkalotic side. All right, now because it's the only vector that's having any effect here is the metabolic one, it's strictly a metabolic alkalosis. All right, we've got and this base excess tells us that it's a huge metabolic component. Let's look at some more examples. Remember this process about how to draw the vectors. Okay, now we're getting into some meat here. We're talking about combined conditions. All right, so combined conditions are very important for us to distinguish. All right, so we've got effects of both the respiratory component and the metabolic component. So we've got a combined respiratory and metabolic acidosis. All right, so here's our reference blood gas. What changes have occurred? Well, we've got a decrease in our pH. Okay, well, that could be just due to the respiratory component, but it isn't. We've got an increase in CO2, all right, and we have this large negative base excess. So how are we going to plot that up? Well, let's start with the respiratory component. Start here at a normal range, and because I have increased CO2, I'm going to draw this because that increased CO2 is going to give us a more acidotic blood gas. All right, so it's going to cause CO2 is an acid, so it's going to give us an acidotic change in our pH. But I also have now, I'm going to draw my metabolic component here, starting at the end of my respiratory vector. I've got a negative base excess. So that's even going to drive me to be more acidotic because always with a negative base excess, I'm going to draw that. This is going to make me more acidotic. Okay, so you can see here I've got the respiratory component and the metabolic component combining to give me a respiratory and metabolic acidosis. Now this large base excess and a low bicarbonate tells me that my metabolic component is large and my respiratory component is both large. So it's a combined respiratory and metabolic acidosis. So the next condition we're going to talk about now is a combined condition again about a combined, so the combined conditions, we notice that our arrows go in the same direction. Both our respiratory and metabolic arrows go in the same direction when we look at vectors. So this time we're going to talk about a combined respiratory and metabolic alkalosis. So clearly we're going to have an alkalotic pH because we're talking about an alkalosis. And we've got a decrease in CO2 and an increase in pH. Key thing I want to point out to you, though, to make this very simple, is that we have a positive base excess. And that tells me that we've got a large amount of bicarbonate. And you can see that this is increased over our normal, but this tells me I've got a large change due to the metabolic component. So let's start here with our respiratory. We always plot that first. Now, because I've got a low CO2, that's going to make me alkalotic. So here's my respiratory component, and that's because I've got a low CO2. It's going to make me alkalotic. Now let's plot up our metabolic component. I start here at the end of my respiratory vector, and it's going to take me even further along here because it's a positive base excess. And with a positive base excess, that's going to add to our alkalosis. All right, that's the way I always meant that. Negative makes us more acidotic. Positive base excess makes us more alkalotic. All right, so I end up here with a pH of 7.80. Now notice my respiratory and metabolic components combine to give me a respiratory and metabolic alkalosis. And that's clearly shown here when we draw the vectors correctly. All right, so just a couple of rules about those vectors now. So the next set of conditions we need to talk about are partly compensated conditions. Okay? So in a partly compensated condition, our arrows are going to go in different directions when we look at vectors. All right? So a partially compensated situation. Here's our reference blood gas. And so what we have occurring right here is we have an increase in CO2. That's the major component that we have here. But I also notice that there's a increase or a change in pH as well because I've got a positive base excess. All right, so let's plot this up. Let's just not try to interpret the numbers just from the blood gas. Let's actually plot this up and see what this looks like. So I've got a high CO2. I've got a high CO2 of 65. So that's going to give me a respiratory component that makes me acidotic. All right, so now we've got a positive base excess. All right, this is where it gets a little tricky about these vectors now, because with a positive base excess, that's going to drive me to being alkalotic. So let's look at our actual pH here. So this is going to drive me back here to have a pH of 7.30. All right, so it's not quite in the normal range, and that's why we're using the term partly compensated. Because I'm not in that normal range. If the pH gets in that normal range, it'll be fully compensated, and we'll look at that in a minute. So, okay, so because I've got a positive base excess, I'm going to plot this towards the alkalotic side. I've got a high CO2, so I had to draw this making me acidotic, all right? So you can see my vector arrows are going in different directions. That's your clue that you have a partially compensated condition, and it's mostly respiratory acidosis because our vector, our respiratory vector, is the largest one. Look how big that respiratory vector is. It's much larger than our metabolic one. So we're still a little bit acidotic because of this increased CO2. All right, not from the metabolic component. It's trying to bring us back to that more normal pH. So this is a partly compensated respiratory acidosis. Now let's look at a partly compensated metabolic acidosis. What's occurring there? So let's stick with our same format to analyze this. Instead of just looking at the numbers here, all right, let's just plot this up. So I'm not going to try to analyze or figure it out just by looking at the numbers. Let's do the vectors. So I've got a low CO2, so that's going to make me alkalotic. So you don't have to be too precise here. So I've got a low CO2, that should make me alkalotic. But my pH is acidotic. It's actually bringing me back. I'm still quite acidotic. And this is filled out again, or we know that from our base excess. Look at that. I've got a negative base excess. And we know with a negative base excess, that's going to drive us to be acidotic. So we start here at the end of our respiratory vector. And we go all the way back here to a pH of 7.23. That's that's acidotic. All right. So notice here, my metabolic vector is much longer than my respiratory vector. And you don't have to draw these vectors very, very precisely. You notice I'm just not doing any math. We're just looking at the numbers. A negative base excess means it comes all the way back, and my finishing point for the vector is 7.23. All right. So look at this. Look how long that metabolic vector is. That tells me it's a metabolic acidosis is my primary problem. And that could be because I've got a lot of hydrogen ions in my body. Maybe I was hypoxic for a while. I've got increased lactate levels, or maybe kidney failure. It's only partially compensated because my pH is still on the acidotic side. I'm not in that normal range yet. So this is a partially compensated. You know, the partly compensated conditions are going to be recognized by your vectors are going in different directions. So another partly compensated condition that we are going to take a look at here quickly is a partially compensated respiratory alkalosis. So what does that look like? All right, clearly I'm talking about a respiratory condition, so let's just analyze the blood gas on its own. Let's not make any determinations. Let's just plot the data. So I've got a low CO2. So I'll put out a CO2 vector because a low CO2 is going to make me alkalotic. So we've got a low CO2. Now, my base excess is telling me that I'm negative, minus 4.7. So that means I'm going to just plot up my metabolic vector here. We start at the base of our respiratory, and that means I'm going to be drawn it this way. All right. Now, I'm going to end at 7.53 because that's my actual pH of my patient, 7.53. That's what I get from my blood gas. And that still means I'm on the alkalotic side. I'm not quite in that normal range here yet. So that's why this is a partially compensated condition. I'm not in the normal range. Now, the respiratory vector is much larger than my metabolic vector. So that indicates that I've got a respiratory condition. It's an alkalosis because I've got an alkalotic pH. So I've got a respiratory alkalosis, a partially compensated respiratory alkalosis. Okay, so watch carefully when you plot up your vectors. You can see your metabolic component, and what's happening here is that the body is kicking in with the kidneys, trying to change the condition. It doesn't like the fact that I've got this chronic respiratory alkalosis. It's trying to make me come back into that normal range. The body always wants to have a normal pH. Okay, so let's look at another condition. Okay, here's a partially compensated condition again, and this one's a metabolic alkalosis. But let's not jump to conclusions. Let's just look at our patient's blood gas. This is the blood gas we've got. We're going to follow our vectors. We're not going to make any predetermined ideas. Let's see what it looks like. So I've got a high CO2. Let's always start with the CO2. So that's going to make me acidotic. So let's come over here. We plot our respiratory component out. That's going to make me acidotic. I've got a high CO2. Okay. All right. Well, okay. Let's take a look here. Now, my pH, though, is actually alkalotic. And my base excess is a positive 16. So it's a really big component. So let's start here at the end of my respiratory like we always do. And let's draw my vector all the way back here. And it's going to take me to a pH of 7.55. All right, that's where I'm going to end up here. pH of 7.55. So look how big that metabolic component is. All right, and I ended up with a metabolic condition here. So this is a partially compensated metabolic alkalosis because of this alkalotic condition. We know it's mostly metabolic because look at how big the vector is. Look at how big this base excess is. So what's happening here is, for some reason, I have a large amount of probably of bicarbonate. Something's happening with my body so that I've got all this bicarbonate buffers in my body. And the way I'm compensating for that is by decreasing my minute ventilation to increase my CO2 to have a little bit more acid to balance out all that alkalosis. If I normalized my CO2, I'd even be more alkalotic. So this is a compensation mechanism that the body has kicked in with to try to compensate by decreasing my respiratory status and balancing out, trying to get us into that normal range of pH. The next set of conditions we have to consider are fully compensated conditions. So we've got full compensation. Now, how you know to get started right off that it's something that's fully compensated is that in my blood gas that we're interpreting, this one right here, I've got a normal pH. We're in that normal range. So something's going on. Something's going on. Well, let's not try to predict right off the bat. Let's just plot this out. Let's use our vectors. So we start always on our 0, and I've got a high CO2. So with a high CO2, that means it's driving me to be acidotic. All right, high CO2 makes me acidotic. Okay, well, let's not predict here what we're going to see. And then I'm going to draw my metabolic vector here, starting at the respiratory, end of the respiratory. And I've got a positive base excess, so I know that's going to be in the opposite direction, making me alkalotic. And my end condition is a pH of 7.36. Let's draw that out. And here we end up with a pH of 7.36. So that's brought me back into this normal range. Here's my metabolic component. So the biggest factor here is my respiratory, but it's balanced by what's going on with my metabolic condition. So because the respiratory condition is slightly longer and I'm kind of on the slightly acidotic side, and that's being controlled by my respiratory system because I've got a high CO2, I'm going to call this a fully compensated because I'm in that normal range of pH, and it's a respiratory acidosis. That's what's causing this shift and these balances back and forth with my blood gas. So here I've got somebody who's got a chronic or maybe a high level of CO2 retention, and the body's compensated by that by retaining probably bicarbonate through the kidneys. So here's somebody who's potentially chronically hypoventilating with a high CO2, and this may be consistent with somebody like a COPDer who's in a steady state, and the body has compensated for this chronically high level of CO2 by retaining bicarbonate, and that's reflected in both my high bicarbonate values and in a positive base excess. You notice I'm harping about the base excess because that clearly identifies that change in pH due to metabolic conditions as compared to respiratory conditions. So let's look at another one. Okay? Well, now we've got a fully compensated metabolic acidosis, but let's not jump the gun. Let's start with our procedure. Let's plot up our respiratory component. So this is the blood gas we're looking at. Okay, so compared to the normals, I've got a lower CO2. So that should have made me alkalotic. All right, my respiratory component, because I've got a low CO2, should have made me alkalotic. And then I look at my metabolic components. Let's change our pen color here. And I've got a negative base excess. All right, and I'm got a normal pH. That's why I know it's fully compensated. I should be alkalotic because of my respiratory condition, but I'm not, because I've still got this slightly, it's in the normal range, pH, from my metabolic condition. Now you notice the metabolic vector is ever so slightly, I'm still on that acidotic side a little tiny bit, in the normal range, but a little off. And so I'm going to primarily make this a metabolic acidosis. Now when they're in total balance like this, it can be very difficult to tell. But we're going to call this a fully compensated because I've got a normal pH, and yet I've got this seesaw action. My arrows are going back and forth, so I'm in balance. So I've fully compensated for this metabolic acidosis. So the body's retaining a lot of pH because of some other condition, and what I've done is I've actually increased my respiratory rate to blow off the CO2. I've reduced my CO2 to compensate for that, and that actually happens quite often with our patients when they become metabolic acidotic. It could be from hypoxia, it could be increased lactate levels. We increase our minute ventilation because the body always wants to maintain in this normal range of pH. So let's continue our discussion of fully compensated conditions. We know they're fully compensated because even though we've got major changes in our blood gas, this is the one we're going to look at right now, we've got a very unusual CO2, we've got an unusual base excess, so we know something's going on. Let's just find out what it is. So let's start by looking at our respiratory component here. Now I've got a low CO2, 25, so that should make me alkalotic. All right, so here's my respiratory component, but my pH is showing a minus base excess. All right, so when we plot that out, we start here, and I'm going to draw this back, and that's going to give me a pH of 7.44. All right, so my metabolic vector, even though it's balancing out this change in respirations, it's not quite normalized my blood gas. Well, it is in the normal range, but it's slightly on the alkalotic side. So my respiratory vector is slightly longer. So I'm going to classify this one as being a respiratory alkalosis. And this can be a little bit of a judgment call sometimes, all right? But you'll notice the key factor here is that I'm just slightly on that, within the normal range, but I'm on the alkalotic side, so my metabolic vector isn't quite as long as my respiratory vector. So we think probably the respiratory component is the key one to bring this about. It's fully compensated because my pH is in the normal range. Okay, so let's take a look at one more of these fully compensated situations. So we're going to start off again here. I'm going to start with my respiratory component, and here's my blood gas. So look, plotting it out here. Now here, my CO2 is high. I've got a high CO2. So that should be plotting over to the acidotic side because I've got a high CO2. All right, so my respiratory component should be taking me over to be acidotic. I've got a positive base excess, and I'm in the normal range for a pH. So a positive base excess, let's plot that out now. That's going to go in the opposite direction because I know that a positive base excess should bring me over to the alkalotic side. So let's plot this out. And my end pH here is 7.43. You notice I don't have to do any math here. So my metabolic component is slightly longer than my respiratory. Now they're pretty well balanced out. That's why I'm calling this a fully compensated metabolic alkalosis, because it kind of insinuates, because the body always is never going to overcorrect. So because this metabolic vector is slightly longer, I'm going to call it primarily a metabolic condition. So what I'm insinuating with this classification is that by decreasing my minute ventilation, by allowing my CO2 to rise, I'm making the body more acidotic to compensate for this chronic alkalosis. And this could be because of kidney failure or something where I'm retaining lots of bicarbonate. You notice the bicarbonate levels are very high. I have a positive base excess. So it's a fully compensated metabolic alkalosis. Fully compensated, normal pH. Metabolic, because my metabolic vector is slightly longer than my respiratory. It's an alkalosis because I'm slightly on the alkalotic side. All right? So a fully compensated metabolic alkalosis. So I'm hoping that this short video helped you graphically identify what's happening when we're talking about arterial blood gases and the classification system. We've covered all the basic classifications that can occur, and I'm hoping by seeing them graphically, that's going to improve your understanding of the interplay between pH, CO2, bicarbonate, and base excess. You notice I'm focusing on that base excess because I think that's a really good indicator of the changes in pH due to the metabolic component. So my name's Alan Prost. I hope that you watch this video a couple of times and it helps you with your arterial blood gas classification. Thank you.